Hi everyone, my name is Alexis, and today I'll be discussing croup in children and reviewing common symptoms, treatment options, and important caregiver information. Because croup is very common in pediatric respiratory illness, it is important for parents and caregivers to recognize early symptoms and warning signs of respiratory distress. Croup is a viral illness that causes inflammation and swelling in the upper airway. This swelling affects the vocal cords and trachea, leading to the characteristic barking cough and noisy breathing, or stridor, often heard in young children. The most common cause of croup is the parainfluenza virus. It spreads through respiratory droplets from coughing and sneezing, which is why outbreaks are common in daycare and school settings. Cases also tend to increase during the colder months. Children between 6 months and 3 years old are most commonly affected because their airways are smaller and more easily narrowed by inflammation. Children exposed to frequent viral illnesses may also have a greater risk of developing croup. These symptoms may resemble a common cold, including a fever and a runny nose. As airway swelling increases, children can develop a barking cough, hoarseness, and inspiratory stridor. Symptoms are often more noticeable at night. The infection causes swelling in the larynx and trachea, narrowing the airway and making airflow more difficult. Because pediatric airways are already narrow, even mild inflammation can significantly affect breathing. Treatment depends on symptom severity. Mild cases are usually managed with rest, fluids, and supportive care at home. Providers may administer dexamethasone to reduce airway swelling, while more severe cases may require nebulized epinephrine for respiratory distress. Caregivers should encourage hydration, allow the child to rest, and try to keep them calm because crying can worsen breathing difficulties. Parents should also monitor for worsening cough, increased work of breathing, or decreased fluid intake. Emergency medical attention may be needed if the child develops stridor at rest, bluish skin or lips, difficulty swallowing, or signs of dehydration. These symptoms may indicate a severe airway obstruction. To reduce complications and prevent spreading infection, families should practice hand hygiene, avoid smoke exposure, and follow medication instructions carefully. Monitoring breathing closely during illness is also important. Although croup cannot always be prevented, the risk can be lowered through frequent hand washing, disinfecting commonly touched surfaces, and avoiding close contact with individuals who are sick. Most children recover from croup within a few days, but parents should understand the warning signs of respiratory distress and know when further medical evaluation is necessary. This review reinforces important information about recognizing symptoms, providing supportive care at home, and identifying signs that require emergency treatment. These evidence-based references were used to provide accurate information related to pediatric croup and caregiver education. All images were pulled from the PowerPoint stock images. Thank you for watching.